very excited to have you with us today. My name is Alexandra Johnston, and I am the Regional Manager for the Corporate Fellowship Program. I'm joining you from Tampa, Florida, and I'm thrilled to be here for this employer panel on the healthcare industry. We will soon hear from our guest speakers, and I'm very excited to be joined by representatives from Amedisys, Ascension, and the Mayo Clinic. But before we get started, I wanted to add a quick reminder that there's a Q&A section at the bottom of the screen where you'll be putting in your questions. There is a chat function as well, but it's better for us to keep track of questions in the Q&A. So I'll be pulling questions from there as we get started. And I'd like to now go ahead and introduce our speakers. So we will be hearing from Maria Bayer. She is the Diversity Recruitment Specialist, Veterans Workforce Development at Mayo Clinic. We're also joined by Josh Deason, the National Military Veteran Talent Specialist at Ascension, and then Yvette Hansen, the Director of Talent Acquisition at Amedisys. Thank you all so much for joining us today. I look forward to our discussion. Before we start the Q&A, I'd like to turn it over to you to tell us a little bit about yourself, about your company, and what fuels your company's desire to hire military-connected talent. So we'll go ahead and get started with Yvette.
Hi, thanks, Alexandra. So yes, I'm Yvette Hansen. I'm with Amedisys. I've only been with Amedisys for a year. I can tell you why I came to join Amedisys. The reason I came is because something they said to me in one of our conversations was, if we don't fill positions here, we're turning away people when they most need us. We're a home health and hospice company, recognizing that in that time of their lives, they're most vulnerable, and we employ home health nurses and care agents and LPNs, and so they're going to the people's homes and serving them. And the reason we're so passionate about veterans is because we recognize that veterans and military spouses are built in the same fashion that we built our company on, which is servant leadership. We want to serve our community, we want to serve our patients, and we recognize that a lot of our veterans joined the military in order to serve and to make this country great. And so we really want to honor them and provide them an employer where they can continue to do that even after they're out of the military. And the same is said for military spouses. We recognize that they're a different breed of people, and those are the kinds of folks we want to come work here with us.
Thank you so much. Josh, over to you. Tell us a little bit about yourself, your company, and what fuels your company's desire to hire military-connected talent.
Absolutely. Good afternoon, everyone. So I am Josh Deason. I'm an Army veteran, recently transitioned in 2016. Not too far removed from the service and from the pains of transition. So for Ascension, we're a nonprofit organization, faith-based organization. We cover 16 states right now in the United States. We're headquartered out of St. Louis, Missouri. I myself am out of Birmingham, Alabama, if you can hear that in my accent. And what we do for veterans and military spouses, one thing that we like to see is just the leadership qualities that veterans have, and also military spouses, the ability to react and still perform under adversity, like we had to do through this past year, and just the qualities and the quality of work that you can get from veterans and from military spouses. Ascension recognizes that. We actually just started our military recruiting program last year, at the beginning of the year, and so it's been a really big push, and we've seen a lot of good things out of it from working with the transition offices on the military installations. So we're absolutely happy to be here and happy to hire some more veterans and military spouses as we move forward.
Thank you so much. And Maria, over to you.
Hello, my name is Maria Bear, and I am a Veterans Recruitment Specialist at Mayo Clinic. I started in this position about a year and a half ago. And here at Mayo Clinic, what fuels our desire to hire veterans is that Mayo Clinic itself was built on the foundation of military traditions. The Mayo brothers, they were veterans in World War I, and as a matter of fact, a lot of the medical advances that we have today that we use in the military and in the civilian life were created, invented at Mayo Clinic. And so we want to continue to build on those rich traditions at Mayo Clinic. If you look at our values as an organization, they are so beautifully intertwined with the military values. And for me, being a veteran, transitioning into Mayo Clinic, that was my first job after the military. It was a perfect fit for me, and I just want, I look forward to connecting with people and sharing why I think Mayo Clinic is such a great place to work.
Thank you so much for your introductions. And with that, I'm going to jump into our first question about really how your industry and your company has been impacted by COVID-19. And if we could start off with Maria, um, and then we'll go around the panel.
COVID-19, what a time to be alive, my goodness. I think the biggest thing that COVID-19 did for my company and actually for any company was just accelerated us 10 years down the road when it comes to strategic planning, especially when it comes to teleworking and telemedicine. I know at Mayo Clinic, those are two areas where we saw a huge increase, especially with the telework. And a lot of us, myself included, we went home in April thinking that we were coming back. And now here we are in January and we are still working. So a lot of our positions were transitioned to telework. And we continue to do that because we'd like to think that COVID is going to go away pretty soon, but we have to prepare for the what if doesn't, and we have to continue. For us, the biggest thing is continuing to provide the level of care that people have come to expect from Mayo Clinic, while having to transition to this telework, telemedicine type of care. And so far, we have been very successful, and we are very proud to have been able to continue to provide that level of care.
Thank you so much. Definitely have some follow-on questions for that. But over to you, Yvette.
Sure. So we saw a drop off in patient care originally, and then we saw this huge spike because um, people started leaving nursing homes and going to relatives and homes, and and that's what we do. We actually go to people's homes and care for them. Our registered nurses and LPNs do. So we've always seen frontline care givers take excellent care of their patients. We saw an uptick in that, and so we had to hire more. Obviously, it accelerated our game plan. We were on a growth projection anyway, but it absolutely accelerated that. But I would say the greatest change that I witnessed was, well, we always knew that our RNs and our LPNs were taking great care of our patients. A lot of the time you didn't always feel, as a corporate employee, you may not have always felt connected to the patient care. But man, we saw everyone rise to the occasion to make sure that our patients were getting the quality care that they needed. Sourcing and procurement was working around the clock to make sure we had all of the PPE, that we can hand that out. And as you know, you heard it all over the news, there was battles for the PPE equipment. And so we were in that battle too. And we're so grateful that we were able to get all of the equipment needed to our caregivers. We saw our tech team working around the clock to get everybody, as you said, Maria, everybody had to start working from home, and to get the tech team rolling that all out in advance of almost no warning. So that was phenomenal. And even the recruitment team to rise to the occasion of finding more nurses, finding more LPNs, finding more CNAs, to get out on the street and start caring for more patients. It's phenomenal because now everyone started to see the role they played in caring for those patients. And it was awe-inspiring.
Thank you. Josh.
So yeah, we definitely saw a lot of movement within what we were doing as an organization. We also have like a senior living and home health division for Ascension as well. So we absolutely saw some changes in that as well. I was already a remote employee before COVID-19 happened. We have a lot of remote positions actually nationwide, which are something that definitely are sought out after by like military spouses as well. But we did have to start doing some things differently, where we started some of maybe some of the interviewing processes for candidates. We actually made a lot more of those remote, which I believe actually helped the process because it didn't put candidates under pressure to arrive at a certain place or to leave their homes if they didn't feel safe leaving their homes. So, paying attention to things that, hey, certain things that we weren't doing before, they actually are possible to do without being in an office and sitting under the fluorescent lights all day. So we actually, we took a lot of positives from what happened due to the pandemic, and we're continuing to work through that as it moves forward.
Definitely want to talk more about where you're seeing big hiring needs, but to follow on a little bit on the teleworking aspect with regards to remote work, can you comment a little bit more, Maria, on where you see that and how long term you see that being, or do you see sort of that returning to an in-person setting? Where do you see remote work 2021 and beyond?
So for 2021, I definitely see those who are involved in direct patient care, they will continue to be at our hospital campuses. However, there has been a big push for like HR, your IT. We have gone full time telework. And so I know for HR, we've been told we are telework until further notice, which can be any time, but we expected that it's going to be full time. Again, COVID made us actually implement future plans, way earlier than we were planning. This was down the road for us because, telework and telehealth medicine was part of the plan, but we just had the opportunity to implement it. Thankfully, we already had plans for that. We just have to kind of dust them off. But yes, your IT, anything that is not patient care related, you can expect that to be telework. I do have to say, if I may, real quick, because when we were talking about changes in the pandemic, I think some of the unsung heroes, and we saw a high demand for that, were those essential workers, your environmental services, the people that cook your food at the hospitals. There's a lot of controversy with that because those guys had to be there, cleaning the rooms, taking care of patients. And I just want to say they are the unsung heroes of this pandemic.
Absolutely. I'm starting to get a couple of questions in our Q&A here, so wanted to throw this out there. There's a question from Jonathan asking if you have any apprenticeship positions. Joshua or Yvette, we'll start with you and then Maria.
So we don't have apprentice level positions, but we do have internship positions for LPNs and RNs. We are looking to explore some opportunities where we can work with educational systems for CNAs even. So I think there's also an internship program for tech teams. So, but I wouldn't say that if you're looking for an apprenticeship that this isn't the organization for you. I would say that you might come in as something more of an entry level, and we can certainly work out what kind of position and role would best suit you. We don't necessarily need a formal apprenticeship program for you to be considered for an opportunity here.
Thank you so much. Joshua?
So kind of the same for us as well. A lot of internship positions with us. We are looking to expand that, and we've looked into some opportunities, outside of primarily healthcare that would be apprenticeship. So we're actually looking at that in like our business offices and things like that. So it's something that we're looking at in the future, but right now, pretty much only internship level positions right now.
Great. And there is a related question on apprenticeships, specifically for you, Maria. What positions are available at Mayo Clinic for transitioning veterans who are looking for a career in healthcare? Are there any training, internship, apprenticeship positions, opportunities available?
So yes, so at Mayo Clinic, we have different internship opportunities, not so much apprenticeship. There's mostly internships. Unfortunately, if you're not a student, they're mostly students. That being said, we are pretty excited because we just became a SkillBridge partner December 31st. And so we're starting in the second quarter of 2021 with LPN positions in PCAs, looking to expand throughout 2021 at our different campuses. But if you go to the SkillBridge page, you have all our information there.
Thank you so much. Lots of questions coming through. Can you discuss what, if any, veteran or military spouse affinity groups your companies might have?
So I can start with Amedisys. So we are actually in the midst of rolling out some ERG groups, but we did roll out a formal veteran recruiting program, and where we've identified mentors for incoming transitioning service members or spouses who are coming to work for us. So it's not necessarily an affinity group, but we certainly do have mentors that are ready to be aligned. And we did join MSEP, the Military Spouses Employment Program. We've joined TA Online and a couple of other organizations to enrich our partnership and enhance our veteran recruiting efforts.
Yep. At Mayo Clinic, so we have kind of like Yvette, we have a Mayo Employee Resources Group, and that is supports employees who are veterans and also the military spouses. And then we also have a program that goes hand in hand with recruitment of veterans, and we call that accompanying talent. And so if we have a veteran who's interested in Mayo Clinic, what accompanying talent does is tries to help the spouse find job at Mayo Clinic. And if there's not a job at Mayo Clinic because maybe their industry is different, the area specialty, we connect with partners in the communities to try to find them employment in the community, because we know if one spouse is happy, the other one is going to be happy. And so we try to help as much as possible during that transition, because that can be a time of big anxiety for them.
Yeah, at Ascension, from the candidate experience, right from the get-go, we do have like a veteran talent network that kind of pulls everyone together. And we assign members of our talent acquisition team specifically towards veteran and military spouse and transitioning service member applications to go through those. And then right now, I do a lot of one-on-one calls with incoming veterans just to kind of give them an overall kind of an experience of what they can expect with us. And especially how it could relate to their military service. And then we're also in the process of kind of building onto that to where we can actually have dedicated veteran representatives for each one of our ministries and for all of our regions. And so it's definitely something that we're looking to pay attention to. It's a lot of things in the works in regard to that right now.
To follow on from that, Josh, sometimes with transitioning service members that I work with as well, they might not have a background in the healthcare industry, but they'd like to transition into that. Do you see what kind of roles do you see a good fit with, and Are you currently seeing a high demand for those types of roles, or what would you advise transitioning service members or military spouses who want to enter the healthcare industry? Um, what kind of roles they should look into pursuing?
So right now we actually have a lot of success. For one, like in information technology, anything that has to do with cybersecurity, we have a lot of that. We have a really good presence, like in the southeast and around Georgia, around Fort Gordon and places like that, where we tend to look for a lot of cybersecurity individuals. So we see that. We see a lot of military spouses who actually enter into the human resources field, because a lot of those positions, regardless of what company they work for, can be remote. And pretty much our entire human resources and talent acquisition divisions are all remote positions anyway. So we see a lot of those, and then depending on what their degree might be in, or what type of experience they have, we have a lot of project manager positions that are out there as well, and program managers. And so typically military members are going to be looking for some type of leadership role, or something where they can kind of drive their own bus. And so we typically see a lot of applications in those areas.
Maria or Yvette, anything to add to that? Do you see any trends with what kind of roles to transition into from the military?
Yes, so definitely project management. That seems to be a very popular one. For us, we do get a lot of healthcare administration type jobs. And so I need to explain, Mayo Clinic is pretty big. So we have campuses in Rochester, Minnesota, in Phoenix, and in Jacksonville, Florida. And so there's different needs for different campuses. And so one of my roles is, like Josh, I do a lot of one-on-ones with veterans and military spouses for that same reason. A lot of them come to me not knowing where to go to. They want a career change. And one of the things I do is do one-on-ones, and I sit with them and we go through their resume with like a fine-tooth comb. Because a lot of times they may not be sure of what they're going to do next. I always call it peeling that onion back. When you start peeling that onion, you start looking at those soft skills like decision making and leadership, critical thinking. And there's a lot of project management that requires that. There's a lot of compliance type jobs that requires that attention to detail. And so that is why when I always recommend, if you're interested in Mayo Clinic, connect with me. You can do that via LinkedIn, and I can put my information in the chat box, because sometimes it's not that easy. If I talk to you during a career fair, what do you have for me? I like to look at your resume to be able to give you an actual assessment of what opportunities are out there.
I would have to echo both Maria and Josh. I think we see a lot of tech talent when it comes to veterans. But surprisingly, we also see clinical leaders. So somebody could have held an LPN in the military, but because of their leadership skills, they come in as a clinical manager versus an LPN. So we see a lot of that as well. And we're really excited when we see that, because, obviously we want to be able to put people in a role where they feel fulfilled and they don't feel like they're undervalued or having to take a step back. One of the things that is really cool, and I'm going to take Maria's lead on this, is just sharing a little bit more about Amedisys. One of the really cool things about Amedisys is we have 513 care centers across 37 states. And I think one of the things that attracts transitioning service members, or especially military spouses, is that you can take a job here with us as a full-time registered nurse 1 minute, and something in your home life changes, or you're moving and you need to go part-time, or you need to go PRM, which is per diem, just to allow the flexibility to meet your family's needs. And we have the flexibility of doing that with you. So we're hoping to be able to promote that more among the military spouses, and letting them know that moving does not have to be the end of your career. Taking a part-time role does not have to be the end of your career. Taking a per diem role does not have to be the end of your career, because that might just be a moment in time, and then you want to go back to full-time, and we can absolutely accommodate those needs.
And lots of questions coming through the Q&A. There's one here on specifically about entry-level positions. for healthcare information management. These are positions that deal with medical records and release of information. Now, do you have any of those entry-level positions? And then a follow-on question would also be, where should our participants on the panel today go to find out what positions you have open and what you're looking to fill?
I can start. So we do. There's always a need for that. And that's one of the areas where a lot of that has gone remote. So if you're interested in remote and in that area of work, that's one area. So our careers page, and I can put the website in the chat box, is your best bet. It's pretty easy. You can put in keywords, you can put in locations, and it's a very user-friendly careers page. Just be aware we have a lot of jobs out there, so be careful with the keywords that you use. But yes, absolutely.
Ditto, Maria. We have many of those positions open. I think anything related to electronic records, coding, anything like that, we absolutely have those positions open. We do offer training. Same thing, go to our career site, Amedisys/careers, and you can do a keyword search, search by location, which doesn't always work as well. So I would do keyword search. We do also have over, I think it's right now, we have probably 1,200 jobs posted right now. So you'll want to definitely go over it. You can also go to our career site, and if you're feeling overwhelmed or you're not finding the right job, there's a chat bot on there. We call her Recruiting Rebecca. You can either schedule time with a recruiter or just fill in the information and somebody will contact you within 48 business hours.
And it would be the same for Ascension. We absolutely have a lot of those positions available, and those are a lot of our remote positions are in those areas. So absolutely, I've put our military career page in the chat, and then you can also connect with me on LinkedIn if you'd like to have one-on-one conversations. And we'd be happy to help out if we can.
Great. And a follow-on to that would be, what would be your recommendation for preparing for both your resume and for interviews for a position that would align with your skill set on any level, whether entry level or for another type of role that's more experienced? Any good advice and tips on what steps to follow on that?
Well, I'm gonna talk. I can talk to the interview part because I think the way we do interviews has changed completely. At Mayo Clinic, we used to do a little bit of online interviewing, and now that's all we do. And so, my tips are simple. Just remember that even though it's maybe a Zoom or Microsoft Groups, it is still a business environment. And I have seen veterans who seem to forget that. I've seen somebody having a chat from his bed. That was very interesting. And so just keep that in mind. Make sure that when you go to an interview, body language becomes more important too. Because you can come across as very kind of standoffish or a little bit too casual. So, practice in front of the mirror. That's the tip I always give people. Just make sure that you wear professional attire. All right. Be authentic. We can tell that the interview process, it can be a nerve-wracking process because for many of us veterans, our first, the interview in the civilian workforce was the first interview we ever had. And so we understand that you're nervous, but be authentic. Prepare in advance. I always tell people, have what I call the elevator pitch. Have your elevator pitch. There's certain questions that you will always be asked in an interview. Tell me about yourself. So prepare something. Talk about you, about your background, your studies, your career goals. Just have that handy. People seem to have this perception that at interviews, you should not have any papers. No, you're allowed to have your resume, a copy of your resume, or some questions, because we recommend that you bring questions, but prepare in advance. We can tell when you're not prepared. And we were talking offline about this. Try to limit your distractions during interviews. Sometimes it's hard, and I think hiring managers and recruiters have come to understand that. And so a lot of people get a pass on that because we understand now you have kids studying at home full time and you have the dog barking in the background. So, but try, as much as you can to limit those distractions, and I'll be quiet and let the others talk.
That is some great practical advice. I love the practice in the mirror, and yeah, and making sure the environment is not too casual, and making sure you're I share that with the groups of transitioning service members I work with as well. Yvette, advice for interviewing and what to do after you apply on online.
Yeah, let me take a step back too and about the resume. So, I had a friend who recently graduated college, and it didn't dawn on me, like I didn't even look at her resume. And then when I finally did, she kept saying that she wasn't getting any callbacks. And I would treat that as I would treat a transitioning service member and say, have someone else take a look at your resume. Don't be shy. Don't feel embarrassed. Like I think it's an opportunity to help hone and share your skills and your experience. And sometimes you get one shot at it, and um, you don't want to mess that up by not asking someone. So ask someone to take a look at it. If you know a recruiter, if you know someone in talent acquisition, just have them take a peek at it and give them your thoughts and feedback. Um, and then with regard to prepping for an interview, I would agree with everything Maria's saying. I think one of the things that we forget too, sometimes they start with phone screens. So make sure your voice isn't flat. Make sure that you show enthusiasm in your voice, because again, like Maria said, sometimes you got with that one opportunity to tell that person. And I always say at the end of the interview, ask them how you did. If they if and don't be afraid to tell them that you're transitioning out of the military. Don't be afraid to say that you're a military spouse. You know, I think the way that people used to look at that 10 years ago is not the same way that they look at it today. I think that it's definitely looked at more positively and more openly, and we appreciate and just want to honor those veterans and their spouses. And so we want to do everything we can to help them. So don't be afraid to say that and ask them how you did. And if you don't get passed on, if they tell you they're going to reject you, that's fine. But at least you get something to learn back from that interview. You can take away the notes and say, okay, for the next interview, I know that I should be a little bit more quiet about that, or I should articulate myself more in this, or make more parallels when they ask me questions. So that's the advice I would give, is definitely at the very end of that conversation, whether it's a video interview or phone screen, ask them how you think you did. Do they believe you're a good fit? And if they don't, ask them why. And don't be afraid to take that feedback. As constructive as it sounds, it may be the best advice they can give you.
I'll give a couple of quick ones. For the resume, one thing that I've always said is, you should probably, in most cases, never send the same resume to two different job positions, because you should always tailor your resume for the job you're applying for. So while the job might be the same, one company might use a certain term that the other one didn't. Read the job description and make sure that your resume mirrors the terms that are in the job description. A lot of the applicant tracking systems and even recruiters, when they're scanning through candidate profiles, sometimes they're looking for key terms. If you have a recruiter who's over a lot of different positions in different industries, the recruiter might not know what those acronyms are, but they just know to look for the acronym. So if the acronym's listed in the job summary or something, make sure that's listed in your resume, because the recruiter who's looking at it might not even be the expert in that field, who is just screening resumes to send to a hiring manager who is the expert. So just make sure that you tailor that resume. I think at one time I had like 40 different resumes on my computer, because each one of them were tailored to the positions that I was applying for. And then in regard to the interview, with everything going virtual now, the first time that you check your connection should not be when your interview is set for. And that includes phone calls as well. I've had candidates answer a phone call at a lunch break, but they're in the parking deck. And it's, we understand distractions and the differences in the way that we're doing things now, but at the same time, I think you knew before 2 p.m. today that you didn't have a good cell phone connection in your parking deck. And so it's just, little things like that that you can just kind of check ahead of time. Make sure if it's a Zoom interview that you've got Zoom downloaded and you check that connection and make sure it works beforehand. So there's just a lot of things you can do to prepare for that, before the time, just to make sure that you put your best foot forward, and that the first experience with you is a positive one.
Hey, Alexandra, if I may, one thing that goes along hand in hand with that, it's cover letters. And I want to touch on that because cover letters are big at Mayo Clinic. And so, if your resume talks about your qualifications and your skills, the cover letter is where you get to make that recruiter imagine you as part of the company, because that is where you get to talk about why you're a great fit for the company and for that culture. And so I always tell people, do your research of the company, of positions that you're interested in, just so you get a flavor for what the company is all about. And if you, again, I always tell people that is your branding, that is your first um, impression for the recruiters. And what you want is to make sure that they see you and read your letter and say, man, you know what? This person sounds like he would be a great fit for the company.
So really putting in the effort to make it tailored and not standard.
Absolutely.
For all those things. And I do sometimes get that question, should I write a cover letter or not? So thanks so much for addressing that. Question here from Michael. I believe that in the healthcare field, education never really ends. It is part of our job to stay up to date about new developments in the field. Can you speak to your company's plans and policies for employee professional development? Yvette, let's start with you, perhaps.
So it's so funny. I was talking to my VP about that earlier today, because I personally considered going back to school, or am considering going back to school for a master's. But we talked about not just educational development, but professional development. And Amedisys is a huge proponent of that. We have something called Amedisys Academy, where we have PhD staff members on staff writing different material to help promote yourself, how to educate yourself. So these are online learning modules that you can take on anything from project management to speech to public speaking. And then we also offer tuition reimbursement and opportunities for professional development. You just have to share it with your leader and ask them to sign off on it. And it's a rarity that you see any of that get rejected here, because we do believe in professional development and advancement opportunities, whether it's upward or lateral movement that you're looking for.
For Mayo Clinic, education, hugely important. It's actually, if you look at the Mayo Clinic logo, it's 3 shields, and one of them is education. And so it's not just for patients, but it's also for employees. And like Yvette's company, we do have tuition assistance and reimbursement if you want to go to college. And then we also have internally a site where we have every possible kind of module that you want to. If you're in administration, there's modules for you, from something as simple as using Excel to something, more intricate, like some of our internal systems. And then we're also, through Mayo Clinic, are connected to Udemy. So we can go there and we can do training for, project management. If you want to get just hours for your HR, towards your HR certification, you can go through that. So there's always something internally. We have a lot of our resource groups, a lot of them are education oriented. So there's always an emphasis on employee development, not just like Yvette said, not just through education, but professional development. And those two go hand in hand.
Right, and we agree. Same thing with Ascension. We have an e-learning platform for all of our employees, where you can go online and do a lot of different kind of informal certifications and just enhance your knowledge through there. We do have tuition assistance and tuition reimbursement as well, and a lot of that can go towards college degree and also towards any type of certification that's needed for advancement in your position. And then we also have a lot of partnerships out there with our ministry locations to help provide resources for your CME as well. And so, yeah, we have a lot of different avenues to get that accomplished.
Thank you so much. Another question in the Q&A. Do you offer internship in logistics or healthcare management? That be
Not right
Amelia?
now, but it's not at Emeritus, not right now, but we are growing our internship program. So it's not to say that we wouldn't see that on the roadmap somewhere in the near future.
For Mayo Clinic, we have internships in healthcare management. It is not veteran specific, but I can put the link, to the internship side. We call those administrative internship programs. We also have a fellowship. And then in logistics, we do not have at this time, but it is one of those areas that we're looking at incorporating into the SkillBridge program over the next year.
And we're opening up some in those areas. Should be by this fall that they're going to start looking into that. So I'm not sure if some of them are going to be ready for the summer of this year, but they'll probably start loading by the spring of the following year. But it's definitely something I would look at. There's a section on our career site for students and veterans. So just go on that student section and you'll be able to keep up with all of the internships as they come available.
Sounds good. Maria, a very specific question for the Mayo Clinic here. Does the Mayo Clinic have an affiliation agreement with Stanbridge University? And are there any positions for an LVN internship around Anaheim, California? How do we find out what positions are available and the location of the clinic? I guess the example here is, VA uses usajobs.gov. Is that the same link that you provided in the chat?
Yes, but we post our jobs in various different organizations, geared towards veterans. Let me go back so I can see the whole question.
Oh,
Oh, no, that's okay. I can find it. So, I do not know about the affiliation, and I believe the person who has the name is Tim. Tim, if you connect with me, I can find those answers for you, because to be sure, I would hate to give you the wrong answer, but I do not know if we're affiliated with them.
and let's talk a little bit about culture at your companies. It's such an important factor in a job candidate's decision to apply for or to accept an offer with a company. What can you tell us about your company's culture, and how can a candidate make this assessment of their own, and what can they do to research more about the culture at your company? Yvette, we'll start with you.
I knew you were going to choose me first, Alexandra. So I was ready. I had my hand on the mute button. So Emeritus is a family-oriented organization. So when you join this organization, we tell you, welcome to the family. You actually get a letter that says, welcome to the family from our CEO. And the reason why is we feel like when you're a part of a family, that that it's easy to ease into an environment where it's one mission, one goal, we're all working towards it. And I think that speaks highly to veterans and military spouses. It's one mission, it's one goal, we're all in it together, and together we're going to attain our goals, and we're going to meet the mission responsibilities. I think for anyone who's interested in learning more about us, our culture, our philosophy, our values, I would highly recommend that you do a quick LinkedIn search of anyone who works at Emeritus. And you can even do a keyword search of veterans who work at Emeritus. I did it myself, and I came up with a long list of folks, and reach out to them, ask them their advice, ask them their opinion, ask them their experience here. I think that they'll share the exact same sentiment about what it's like to work here, how you'll feel like you're a part of a family, how everyone's in it together. You're never left on an island. You have a lot of support from not just your colleagues, but leadership, from everyone from your boss's boss to our own CEO. He takes the time to visit care centers, at least he did before the pandemic. He's hoping to be able to do that very, very soon. Visit care centers, talk to everybody from as Maria said, everybody from the unsung heroes who are emptying out the waste baskets to his VPs who sit in the offices. So yeah, I think that would be, my advice would be to reach out to other folks who work here. Don't be afraid to ask them to join your network and then send them a message saying you're interested in exploring opportunities here, but you're not sure if this is the right company for you. Would they have 10 minutes to talk and chat about it?
I'll go next. So at Mayo Clinic, I always like to tell people a quick story. My first day at orientation at Mayo Clinic, I left there and I called my husband and I remember saying, this is where I'm going to retire as a civilian. And here's why. I have never been in an organization outside of the military where everything permeates the mission, which is the patients of the needs come first. And I think as a veteran, we always have that intrinsic need to help people, okay, to work towards a mission, to accomplish that mission. And it may sound like a cliche, but you can feel it in the walls of the buildings. Everybody from environmental services, like you say, the person emptying the waste basket, all the way to the CEO, that they're all working towards a common goal. And to me, that was pretty important. Aside from that, the fact that it's built on the rich traditions of the military itself. I found that it was a great place to work as a veteran. I mean, a great place to work, even if you were not a veteran. And so it is a great company culture. I love it. I would highly recommend what Yvette said. Go on LinkedIn, do some research online and ask people about it. Um, I always, believe it or not, or websites like Yelp, stuff like that, you see people that have worked there that have leaked comments about how their experience was, and just do your research, go to the website. Um, Also go to the website outside of the careers website. And what I mean by that, Mayo Clinic has a career website, and then they have like the patient website, and you can see there more about what it is. And as you read about what we do at Mayo Clinic, I think you will get a good sense of why it is a great company culture to work for.
And for Ascension, anytime you're working in healthcare, and if you work for a nonprofit organization, you'll find a lot of the same values where, it's always about service to others. So that's one of the things that definitely stood out for me. Another thing that stood out for me is, one of the first lines on the veterans recruiting page for Ascension mentions teamwork. One of the very first lines on there. And so for that, I've been grateful to be able to experience that. We have a very collaborative working environment. It seems like every week, all of our calls, you get invitations, and it's like, hey, you might want to be on this call, even just in case you have input from your field. Sometimes it's not military veteran related, but they say, hey, we'd like someone to put eyes on this from a military standpoint. And I'll be on a call with, there'll be military spouses on a call as well. And it's probably outside of our realm and not in our to-do box. But they're looking for insights from the military community as well for that. So just, the teamwork that Ascension has, the leadership opportunities, the career progression, those are the type of things that, that we were all used to when we were serving in the military, having that career path, and you knew what you had to do to make it to the next step. And Ascension does a very good job of creating that career path internally for us as well.
Thank you so much. We are getting closer to the end of our panel here, but before we wrap up, I wanted to ask you, as many of our participants know, we are having a hiring fair on the 21st. And what tips would you have for the candidates when preparing for a virtual career fair? And whether it's the one on the 21st or just in general, what would you advise somebody to do in preparation for a virtual hiring fair? Maria, can we start with you?
Sure. So, the Hiring Our Heroes fairs usually are through chat. So, and last October was the first time that I participated in one, and they're time chats, which was nerve-wracking at first. But it was great because it forces you to have a very meaningful, quick conversation in a short time. And so I recommend that you have a prepared introduction that you can type in the chat. This is who I am. This is what I'm looking for. That way you can spend more time with the recruiter just talking about the opportunities. It just saves time.
I would agree with Maria. I would say type this out on a Word document and have it ready to copy and paste because you do have a small window. I would also say though, if you're not a fast typer and they ask you a question you weren't prepared for, do not worry. Type it. Don't worry about typos. Just type it away. And talk to as many people as you can. Talk to every company that's there because you may not. A lot of people haven't heard of Amedisys, especially if you've never worked in this space. And so you don't know what we do, but it might be the best company that you could come work for or talk to. And so I would just say, talk to as many companies as you can.
Yeah, I would absolutely recommend making sure that you speak to everybody, even if you're not sure if they're going to have something that you want. One thing I would also say is it kind of comes into being prepared for these type of things. You know, if you know in advance some of the companies that are going to be there, you know, go ahead and just kind of research those positions. You know, like Marie mentioned earlier, you know, they're timed chats. So if you know, if you log on with me one-on-one and then you're going to say, does Ascension have anything in Texas? Well, I'm just going to go to the Ascension careers page for you and look for you. And now we've wasted, you know, 20 to 30 seconds of our time. So if you just kind of do that yourself, or even while you're waiting for the recruiter to enter the text chat, you know, maybe you click to enter and you're in a waiting room, go ahead and pull up on the side, you know, the company's career page or something, and go ahead and kind of look at that. So, you know, like Maria had pointed out, just that way when you get in the chat and you're one-on-one with a recruiter, you can actually ask something about the positions that you already see on the site. And it definitely saves a lot of time, and you'll get a lot more out of that virtual fair experience if you do that.
Thank you so much for the great tips and advice as we prepare for the virtual hiring fair on the 21st. Maria, Yvette, and Josh, I want to thank you so much for joining us. I learned so much about each company, and thank you so much for your time and for sharing this advice about the industry and tips for career success. To those of you in the audience, thank you so much for joining us today. Thank you for the great questions. Please know that you can find many other recorded sessions on our Career Community Hub. So please do check that on our website, and do check out our events calendar as well for the upcoming career fair that you can register for, which will be on the 21st. So thank you once again, everybody, and have a wonderful rest of the evening.
Thank you. It's been a pleasure.
Thank
Have
you.
a great day, everyone.
Likewise. Bye.
Come visit Amedisys.